Hello, I am Dr. Seth Wiafi, and in this presentation, we'll be discussing the 10 essential services for public health. These slides were originally made for the Centers for Disease Control and Prevention in 2014, and I've modified them for you. First of all, I would like us to look at a little history. The core public health functions were outlined in 1988 Institute of Medicine report entitled The Future of Public Health. The IOM report stated that the three core functions of public health are assessment, policy development, and assurance. This is a good start to describing public health. But in 1994, when the country was exploring issues related to healthcare reform, the public health sector felt that a better definition and description of public health was needed. The core functions of Public Health Steering Committee was convened and involved representatives from public health service agencies such as CDC, HERSA, Office of Disease Prevention and Health Promotion, and many others, and also key national public health organizations. The committee produced a statement called Public Health in America. The Public Health in America statement provides a vision and mission for public health, as well as the context of what public health should be prepared to do and how public health service is delivered. The vision for public health is broad: healthy people in healthy communities. The mission identified is to promote physical and mental health and prevent disease, injury, and disability. These 10 essential services provide a framework for 1. Defining public health activities. 2. Describing public health at all levels. 3. Defining national performance standards. And 4. Providing accreditation structure for health departments. Now I'm going to briefly go over the 10 essential public health services individually and summarize what they are intended to meet. Essential Service 1 answers these two questions. What is going on in our state or community? Do we know how healthy we are? These include accurate periodic assessment of the community's health status, which include identification of health risks, determinants of health, and determination of health service needs. The second one is the vital statistics and health status indicators of groups that are at higher risk than the total population. And finally, identification of community assets that support the local public health system in promoting health and improving quality of life. Appropriate method and technologies such as Geographic Information Systems, GIS, are often used to interpret and communicate data to diverse audiences. Collaboration among all local public health system components include private providers and health benefit plans to establish and use population health registries such as disease or immunization registries. Essential service number 2 answers these questions. Are we ready to respond to health problems or threats? How quickly do we find out about problems? And how effective is our response? This service includes epidemiologic investigations of disease outbreaks, patterns of infections, chronic disease injuries, environmental hazards, and other public health threats and emergencies. Active infectious disease epidemiology programs and access to public health laboratory capable of conducting rapid screening and high volume testing. Essential service number 3 answers this question. How well do we keep all segments of our state and community informed about health issues? This addresses 4 things. 1, health information, health education, and health promotion activities designed to reduce health risks and promote improved health. 2, health communication plans and activities such as media advocacy and social marketing. 3, accessible health information and educational resources. And 4, promote partnerships with schools, faith-based communities, worksites, personal care providers, and others to implement health promotion programs and messages. Essential service number 4 answers the following question. How well do we truly engage people in state community health issues? This includes identify potential stakeholders and increase the awareness of the value of public health. Build coalitions, partnerships, and strategic alliances to draw upon the full range of potential human and material resources to improve community health. And convene and facilitate partnerships and strategic alliances among groups and associations in undertaking preventive screening, rehabilitation, and support of health projects. Essential service number 5 answers these questions. What policies in both the government and private sector promote health in our state community? How well are we setting health policies? This includes A, effective local public health governance. B, development of policy, codes, regulations, and legislation to protect the health of the public and to guide the practice of public health. C, systematic local public health system and state-level planning for health improvement in all jurisdictions. D, alignment of local public health systems, resources, and strategies with community health improvement plans. Essential service number 6 answers this question. when we enforce health regulations, are we technically competent, fair, and effective? And these include assure due processes and recognition of individuals' civil rights in enforcement of laws and regulations and public health emergency actions taken under the governing body authority. Review, evaluate, and revise laws and regulations designed to protect health and safety. Reflect current scientific knowledge and utilize best practices for achieving compliance. Educate people and entities obligated to comply and agencies obligated to enforce laws and regulations to encourage compliance. Perform enforcement activities in a wide variety of areas under authority granted by local, state, and federal rule or law. Some examples include abatement of nuisances, animal control, childhood immunizations, and other vaccinations, food safety housing code, local sanitary code, on-site wastewater disposal, protection of drinking water, school environment, solid waste disposal, swimming pool and bathing area safety and water quality, tobacco control, enforcement activities during emergency situations, and vector control. Most of these define environmental health. Essential service number 7 answers this question. Are people in my state or community receiving the health services they need? These include identify populations with barriers to personal health services, identify personal health service need of population with limited access to a coordinated system of clinical care. Link people to appropriate personal health services through coordination of provider services and development of interventions that address barriers to care. For example, culturally and linguistically appropriate staff and materials, transportation services, and many more. Essential service number 8 answers these questions. Do we have a competent public health staff? How can we be sure that our staff stays current? This includes education, training, and assessment of personnel, including volunteers and other lay community health workers, to meet community needs for public and personal health services. Efficient processes for licensure of professionals, adoption of continuous quality improvement, and lifelong learning programs that include determinants of health. Active partnership and strategic alliances with professional training programs to assure community relevant learning experiences for all students. Continuing education in management and leadership development programs for those charged with administrative or executive roles. And finally, essential service number 9 answers these questions. Are we meeting the needs of the population we serve? Are we doing things right? And are we doing the right things? This essential service include includes the following: assurance of ongoing evaluation and critical review of health program effectiveness based on analysis of health status and service utilization data, and the provision of information necessary for allocating resources and reshaping programs. And finally, essential service number 10 answers this question. Are we discovering and using new ways to get a job done? Public health research activities include initiating research, participating in research by others, reporting results, and implementing policy based on these results. The public health wheel illustrates the three core functions: assessment, policy development, and assurance. In black around the wheel of essential service, in principle, the 10 essential services can be grouped under these three core functions. Starting at the top of the wheel, essential services 1 and 2 fit under the core functions of assessment. Essential services 3, 4, and 5 fall within policy development, while essential services 6, 7, and 8, and 9 fit under assurance. Research, essential service 10, and systems management form the center of the wheel, since these activities are included within all the three core functions. This has been a review of the core functions and essential services for U.S. public health. I am Dr. Oyafi, and thanks for watching.